Hello and welcome. I'm Tafara Gadamo. How has the mental health of young people in Ethiopia been affected by COVID, conflict, and climate change? A recent research report released by the Young Lives Project asserts that anxiety and depression have been on the rise, suggesting serious policy implications. My guest today, Dr. Alula Pankhurst, is here to share his thoughts on the research output. A very warm welcome to the program.
Thank you very much for inviting me.
So I'm interested in knowing a lot more, in exploring the documents that you've published on Young Lives in Ethiopia. This is a project that you started way back in 1994, correct?
This is a project that actually goes back to 2001, and Young Lives is an international study of childhood poverty in 4 countries, in Peru, Vietnam, India, and Ethiopia. And it's been following 12,000 children, and in 4 countries. So in Ethiopia, it's been following 3,000 children, and 2,000 were born in the year 2000. So they're now 23. And we had an older group who were around 7 when the study started. So they are now in their late 20s. And we have these 2 cohorts, which allows us to compare the situation between as they grow up. And we also work in rural and urban areas in 6 regions in Ethiopia, in 20 different communities.
Intro, how did you pick up these 4 countries?
So the 4 countries were looked at the time. This was the Millennium Development Goals, and the UK government aid wanted to understand how children growing up during the Millennium Development Goals period in different settings, in more in third world countries, but in more developed countries such as Peru, Vietnam, that had a very dynamic economy, and then in India with a very populous one, and then Ethiopia at the bottom of that, and seeing how girls and boys during this period, how their lives changed. And in Ethiopia,
for better or worse?
Well, yes, indeed, for better and for worse. And in some senses, the early story was very positive, with in better access to education, healthcare, and the changes in communities with the development of services and infrastructure and roads and mobile phones and so forth. So we actually saw quite a big change in the 7-year gap, because children at the ages of 8, 12, 15 and 19, and compare and see, for instance, that access to education had improved, although quality had declined. We can look at how children growing up, the longer-term effects of malnutrition, children who had access to preschool doing much better as they grow up compared to their peers to school.
One of the topics that I'm interested in, and you've extensively explored, is a mental health issue in Ethiopia. Let's focus on Ethiopia for now. I see that is very important, because it is there is a degree of stigma, massive, if you will, and it's one of the most underreported in Ethiopia.
Yes, indeed. Mental health is a very serious issue. And with the Young Lives study, we did in understanding mental health in adolescence, because this is a key period of development of children as they transition towards adulthood. And we came through periods of great difficulties with the COVID and the conflict and war period, the crises with drought and food insecurity, and also the inflation and loss of jobs and so forth. And we were able to show, Young Lives has demonstrated that these things are interlinked. So we found much higher levels of mental health problems, that's to say anxiety and depression, amongst people in the southern region where there was drought. We also found during the COVID period levels of anxiety and depression increased. And what's quite significant is that as the situation of COVID improved in the other 3 countries, in Vietnam, in India, and in Peru, the levels of anxiety and depression decreased, whereas in Ethiopia they didn't. And we saw also a dramatic increase in 2020 in levels of mental stress amongst our cohorts in Tigray. We have 4 sites in Tigray. And before we lost communication when the war happened, we had 2 rounds of phone surveys. During COVID, we couldn't do face-to-face surveys, so we did telephone surveys. And we had 2 rounds at the beginning of 2020 and the middle of 2020 before the war. And already during that period, the levels of anxiety amongst the young people in Tigray was higher. And what's interesting is that depression was higher amongst the women and anxiety amongst the men. So we are hoping now very soon to go back to the sample of the 3,000 young people in Ethiopia and look at levels of mental stress. And we have an audio self-administered questionnaire so people can ask the questions in confidence. And we will also take cortisol samples, hair samples that give you an indication of stress levels. So the conflict definitely, the food insecurity, the conflict, and with COVID, losses of jobs. So we found that young people who were out of work had higher levels of stress. And we also, interestingly, that girls who were enrolled in education but couldn't go back to education had much higher levels of anxiety and depression than girls who were able to do online courses or were able to enroll.
Interesting statistics. Let's talk a little bit about the food insecurity and drought in southern Ethiopia. You found out that 40% of the households ran out of food?
Yes, so...
is that time period that you covered?
Yes, so
there was an extended period of drought. There was no rains for 3 years at the very least.
Yes, so we did 5 phone surveys between 2020 and 2021, and during that period we were finding that food insecurity, both in terms of the perceptions of not having enough food, and actually having time when people went to bed without food, all this was increasing much more in our sites in the southern region, and also, interestingly, in the urban areas as well. So food insecurity in urban areas has also increased relative to the other areas. And I think that's much more to do with inflation, whereas in the south it's drought, there was locusts at that period. So it was a very stressful period. And we also know that food insecurity in infanthood has longer-term effects because we've been following the malnutrition, and young children can catch up from malnutrition and even in their school results, but some of them are affected for life. And so this food insecurity is really a very critical thing. And we also were suggesting that it was important to have school feeding, because until we did this study, it was believed that if children were malnourished during the first 1,000 days, that was the end. They would not recover. But we were able to show that a good proportion of the children in all 4 countries, and especially in Ethiopia, did recover. So that's a very hopeful sign. And that
recovered within that time period?
Within, if they got better nutrition, not even during that period, but afterwards, which was what was new, because the scientific evidence until then was you had to intervene in the first 1,000 days. We were able to show that children recovered later. We're not an intervention program, but we were advocating the use of school feeding, which has now become very widespread in the country and is really critical.
Oh. And it was also accompanied by job losses, right?
That's right. And the job losses was the COVID period and the conflict period were also key problems, and young people who were losing jobs were experiencing much higher levels of anxiety and depression. And interestingly, for women, the problem globally in the 4 countries has been more so because they were often the ones who lost jobs earlier, and then they had to go back to traditional roles of more care work, of more domestic work. Girls who were going to school were finding that they were not having time to study, and so more.
But I would have thought otherwise, because I would have thought that there were a lot more men employed than women.
Yes, indeed. So overall, more of an impact on the numbers of men, but of the women who were employed, the fact that the women were often the earliest ones to lose their jobs, even if they weren't as many as the men, and the fact that they went back to traditional roles, and for adolescents, the risks that they would be risks of early marriage, risks of domestic violence, the mere fact that they were having much more of a domestic load when they were not able to go out, and especially since childcare facilities are very limited.
Yeah, anxiety and depression, they're not only limited to Tigray, but also to other parts of the country that were affected by the conflict, although you didn't reach out to those people out there in your research time.
Absolutely. So, yes, indeed. So we were finding actually, since this is a longitudinal study, we were finding that comparing to the last survey, which was in 2016, indicators of well-being had gone down. So this period of the COVID and conflict really has led to a decline in people's sense of well-being. We were able to measure and demonstrate that. But more specifically in this recent period of the COVID and the conflict, overall in the country, levels of symptoms of anxiety and depression have increased. And so, and the thing is that psychosocial support is very limited in this country. I mean, generally, the levels of funding for mental health is much, much lower than for other aspects of health, 2% in a UNICEF study. And so that means that, support for the mental health is very poor in any case. And then we know that the COVID crisis has increased anxieties. 25% people in a WHO study were facing much higher levels of mental stress during COVID. And so this period has been extremely stressful, and particularly with the effects of war and the psychosocial impacts, the need to integrate psychosocial support to people who've undergone the trauma and post-traumatic disorders. This is something that really needs to be taken seriously. Generally, when there has been a crisis, whether it is a food crisis, and we're able to show the links between food insecurity and mental health, or whether it is a war and conflict, the people tend to forget the mental health side and deal just with the physical side of, say, war injuries rather than the trauma.
Yeah, and the women are affected tremendously by this, right? Whether you call it COVID or conflict and so on. And most of the girls who have dropped out of school, for example, most of them haven't returned back.
That's right. So there is a much bigger risk for girls of not going back to school and being married early. So definitely that's true. And then in war, the whole question of rape and gender-based violence is a very big issue and a very controversial issue and a complex one to try and understand. And so we are now going to use audio questionnaires where they have the headphones and a tablet. And so the young people throughout the country will be able to do a self-administered questionnaire where they hear the questions about conflict and about mental health and so forth. Also other issues like drug addiction and sexual and reproductive health and so forth. They can answer these questions in confidence. So we're hoping the next round of research will be face-to-face rather than phone surveys, and that will happen in October. And then we will be able to get some robust data as well as the hair samples, which will give us indications of stress.
It's very difficult, isn't it, to collect data in terms of in regards to mental health issues?
Yes, it is a very complex issue, and we have a series of modules and questionnaires and scales that require some complex analysis. And it is an area where there is a lot of stigma, so it is not easy to ask questions. But there are a number of validated psychosocial scales that have been tested in different countries. And we started using this at this particular period in the 4 countries because we were cognizant that the mental health aspects of COVID were understudied. And because of the age of our young people, when they were small, we studied nutrition. That was the focus. As they were adolescents, education became the main target. Now, as they transition to being young adults, the transition from education to work is important, but also the transition from living with their families to setting up their own homes becomes really crucial. And that's also why we have had a particular focus on mental health and sexual and reproductive health.
Let's talk a bit about their hopes and frustrations. 20 years on.
Yes, well, we have these 3,000 young people that we've been studying, and we have a smaller group of 100, only in 5 sites, that we do our qualitative substance sample that we really get to know very well, because we interview them in a much more in depth about their hopes, their aspirations, what they want to be. And we can see that, early on when we talked to them when they were 8 and 12, many of them had very high hopes of becoming doctors, the boys pilots, the girls maybe nurses, and so forth. And then the reality, this is a pro-poor sample in the rural areas, in food insecure areas, in urban poor areas, and so forth. The realities of dropping out of school for many, early marriage for girls, in many senses, did affect a lot of their hopes, began to become reduced of what they aspired to. But what's interesting is that we, in spite of all the adversity, there were many instances of resilience. So we've also done, in a study with UNICEF that looked at transitions to adulthood, we did a 5th qualitative wave, and we did look at the question of how, what were the main disadvantages in terms of location. The difference is how living in a rural area disadvantages you, being a girl versus a boy.
And how they overcome those.
Yes, being in a poor household compared to a rich household, and then a household that's faced shocks. If there has been the death of a parent or the illness of a parent or a divorce, or these kinds of things affect the pathways and trajectories of young people in adverse ways. And we're able to document both the negative side and the hopeful and positive sides. So, we were talking about, I don't want to talk just in terms of doom and gloom. If we talk about positive things, we were able to show that relations with parents, and especially with peers, with parents in Peru and with peers in Ethiopia, made a tremendous difference. That young people who had good, strong relationships with their peers had less levels of mental stress. And so that means that, the youth groups and girls' clubs in schools and fostering better peer-to-peer networks can be really important in reducing mental health stress.
So how do you share your research outputs with stakeholders, including the government and other agencies?
Right. So we produce policy briefs. We have 2 websites, an international website and a specifically Ethiopian website. We're actually just relaunching that. And then we work closely with the Ministry of Women and Social Affairs, and we have what is called the Child Research and Practice Forum, and that meets every month. Every last Thursday of the month, we hold a meeting that anybody, and where research is presented. For instance, we had our work on sexual and reproductive health, and we presented that. But the Ministry of Health presented their adolescent sexual and reproductive health strategy at this forum, and then other research programs also presented theirs to try and create some policy debates on what needs to change, what should we have. So, for instance, There were controversial things like we were able to find that girls had much less knowledge about sexual and reproductive health than boys. So at the age of 15, the girls and boys had the same level of knowledge about HIV/AIDS, STDs, pregnancy and so forth. By the age of 19, the boys had much better knowledge and the girls much. In fact, the level of boys and girls at 19 is still pretty low. It's not high enough. It's under 50%. But the difference between the boys and the girls was really startling. And so that means that how do you tackle sex education in schools? There are biology classes, but is that enough? Should the girls' clubs be involved? And then, of course, there is the fear of parents and teachers that if you start talking about sexual education, that will promote promiscuity. But then if young people are involved in relationships and get pregnant early, then, there is the risks of unsafe abortion. And in our sample, we had girls who took pesticides or
pretty common
traditional medicine and died or only just survived. So abortion is a really big issue. And then even if, if a girl has a child out of marriage, then the stigma and so forth is very terrible, or she may be pressurized to get married early. And then so access to contraception by unmarried women is a particular problem. And then also abortion services. So if a young woman is married, and then comes under tremendous pressure to prove her fertility, to have a child quickly, not to use contraception, by her husband, by her in-laws, and often her own family. And so she has to have a child early. And then maybe she has 2 children, and then she wants to have a break and space. And then she gets pregnant, but there aren't proper abortion services. The law in Ethiopia doesn't allow. Abortion is illegal unless you are underage, unless you have a mental problem and are unable to look after your children. I mean, the Ministry of Health is doing a great job in providing those services, but the legal aspect is still not very progressive.
How about women and girls seeking those services? Has it increased?
So access to health and sexual reproductive health services has increased. It's really been very, very good in terms of, for instance, safe delivery and institutional delivery, going and giving birth in hospitals, has increased very dramatically. But if you're an unmarried woman or a divorced woman, there's a lot of stigma about going and giving birth in hospitals. And during the COVID and the conflict period.
And you have home births being reported in several.
Exactly. And also first-time mothers. So there is a tradition of women wanting their daughters to give the first child to be born at home. And that's quite strong. But the Ministry of Health had a very clever policy. First of all, prioritizing ambulances for delivery. And for the coffee and porridge ceremonies, which did encourage women to feel that the birth at home was a bit like the traditional ceremony at home, the birth in the hospital. And so there was a very big increase in uptake in delivery in hospitals, except that during the COVID period and the conflict period, there has been a bit of a falling back, both in access of contraceptions and also in home delivery.
More so in the conflict period, right?
Well, we don't actually.
The ambulance services were brought to nothing.
Exactly.
The health institutions were almost ravaged in Tigray and parts of.
Indeed, and this is really the post-war reconstruction efforts of the health services. We talked about mental health, but also sexual and reproductive health, and more generally, is really something that needs to be prioritized. And in October, when we go back, since we have the baseline data of what was happening before, we'll be able to look at how what has happened there.
So, how well received are your research outputs?
Well, I think we have.
The earlier said is some of them are controversial, right?
Yes. So, we presented our sexual and reproductive health and mental health policy briefs to the Ministry of Health, and that had a really very engaged discussion about many of these issues, such as sex education, abortion, and so forth, where I think there is a room for a lot of improvement. And the Ministry of Women and Social Affairs, we've been working with them for a long time, co-running this monthly seminar series. So when they had the child policy or the harmful traditional practices policy. So we did some work on female genital mutilation or cutting and looked at that has been declining. Child marriage has been declining. Abduction has been declining. But there are hotspots and areas where these are still serious problems. There are big regional differences. And so we've been working with the Ministry of Women and Social Affairs to understand better and think of how you engage communities to prevent these practices and bring about change. And there is a risk when some of these practices that they could go underground when it is illegal. So you need to convince people's hearts and minds and work with traditional leaders, with religious leaders, work not just with women but with men, and through schools and media and so forth. And rather than just imposing the law, you need also to convince people so that practices don't go underground. So we work very closely with the ministries. We work also with the Ministry of Education on improving education. Early learning is a particular area. We work closely with UNICEF also, that sponsored some of our research. Packard Foundation funded the sexual and reproductive health work. So through their networks, we've presented to their donors. It was difficult during the COVID period because there was no face-to-face meeting. So the Child Research and Practice Forum was online, and we're just about to go back to a hybrid model.
Well, good luck with that. And thank you very much for joining me to talk about this important issue.
Thank you.